Hi, I'm Dr. Katina Alphys. I'm a cosmetic medicine physician. When you're seeking cosmetic treatment for the first time, it can all be a little bit confusing. Today I'm going to give you some insight into questions to ask when you seek your first consultation. What motivates a person to seek cosmetic enhancement varies with the individual. How we look affects the way we feel. Our faces are very expressive. Repeated muscle contraction can lead to permanent lines and wrinkles, and this can give someone the persona of feeling sad or looking sad, looking angry, looking tired, and eventually this can affect their self-esteem. Studies have actually shown that treatment satisfaction corresponds with greater self-positive perception. In my experience, the individual seeking cosmetic enhancement wants to look as good as possible for their age. They also want to look as natural as possible, and they want to look rested and relaxed, not tired and angry. In Australia, there's two broad categories of anti-wrinkle injections. There's wrinkle fillers, and they're important in plumping lines and wrinkles, enhancing lips, and recontouring the face. As opposed to wrinkle relaxers that treat the muscles of facial expression, they improve dynamic facial wrinkles. With the growing acceptance of anti-wrinkle treatments, this has led to one particular brand being used as the byword for all anti-wrinkle treatments. Much like the way we use Panadol instead of paracetamol when we refer to pain relief medication. In Australia, there are 3 different wrinkle-relaxing treatments available and approved for use by the Therapeutic Goods Administration. The 3 products are Dysport, Botox and Xeomin. It's also important to note that in Australia currently we have no generic medications approved. When assessing what a client needs for cosmetic enhancement, it's important to treat everyone as an individual. It's also important to exclude certain medical conditions that can interfere with the treatment process. More specifically, pregnancy, breastfeeding, previous facial surgery, and some specific medical problems. If you're considering treatment for the first time, it's important that you ask pertinent questions of your clinician. Things like your treatment options, the treatment process, when you can expect results to appear, how long the results will last, are there any possible side effects, is there follow-up required? It's also important to match your expectations with the treatment outcome. There are 3 different anti-wrinkle treatments approved for use by the Therapeutic Goods Administration. They are all individual and distinct and can vary in the amount of time it takes for the results to appear and the amount of time that the product will last or the effects will last. For example, Dysport, the results can appear within 2 to 3 days. For Botox, the results can appear within a week. And for Xeomin, the results can appear within 2 to 3 days. For the duration of effects, Dysport can last beyond 4 months. Treatment with Botox can last at least 4 months. And treatment with Xeomin can last up to 4 months. The dose of these 3 anti-wrinkle treatments are all measured in units. However, it's important to note that the units are not equivalent between the 3 products and they can't be compared. It's a bit like shoe sizing in Australia versus shoe sizing in Europe, or even comparing the metric to the old imperial system. When you're considering cosmetic treatment for the first time, it's important to do your research. It's also important that you feel comfortable with your chosen clinician and you're comfortable with the treatment process. Remember, there are 3 individual and distinct brands of anti-wrinkle treatments: Dysport, Botox and Xeomin, and they all vary slightly. It's important to speak with your clinician so you can decide on the best outcome for you.